The Volta River Authority's Northern Electricity Distribution Company, NEDCo, has disconnected power to the Upper West Regional Hospital over 20 million Ghana cedis debt. The disconnection has brought all operations at the hospital to a standstill, leaving patients stranded. Correspondent Rafiq Salam has more.
Out of the 82 million Ghana cedis owed via NEDCo by ministries, municipal, district assemblies and government agencies and institutions in the Upper West region, about 1/3 of the amount, pegged around 20 million Ghana cedis, is owed by the Upper West Regional Hospital. After disconnecting the Dr. Helen Liman Technical University and the One Nation Training College last week, the next stop of the revenue mobilization drive was at the Upper West Regional Hospital. Upper West Area Manager of the VRA NEDCo, Engineer Francis Yemiso, led the charge.
For over 1 year now, they've not paid anything. And with them alone holding 20 million Ghana cedis, how are we going to run this going forward? As such, we've agreed with them. So, as we speak, we've disconnected supply to the facility. We are still going to engage, and if they are able to come halfway, we are definitely going to reconnect them. So this is where we stand now. We are even asking them to pay at least 30%. Per our agreement, you are supposed to pay 75%. Looking at the critical nature of the facility, we are asking them to pay at least 30% of the total amount. And currently they are telling us that they don't have anything in their coffers to even give out anything.
Engineer Yemiso noted that since they started the exercise, they are yet to hit their target, and as a result, has sent some demand notices to some organizations and institutions.
Our target for this exercise is 89 million Ghana cedis, and the chunk of the amount is owned by the Ministries Department and Energy. As we speak today, we have collected only 1.9 million Ghana cedis. So you can see we are nowhere near our target, and we need to continue. We've served some demand notice to the BNI, now they are called NIB. We have served demand notice to the Ghana Police Command, to the Ghana Fire Service, to prisons. Some agencies have also been disconnected, and we are still engaging them. All those demand notices should take 14 days. After 14 days, if they are not forthcoming, then similar action that have been taken here will be taken at those facilities.
There was total darkness at all departments of the hospital after the power was disconnected from the source. All activities at the hospital was halted. The patients became helpless and confused, thereby aggravating and worsening their plight. Dr. Robert Amesier is the medical director of the Upper West Regional Hospital.
People are in the neonates are in the NEDCo line in incubators with no light. People are in the ICU with no light. People might need emergency surgery. In fact, this morning we had an accident involving 2 buses on the Kumasi-Accra way, and a lot of patients have been brought to us. So with our light, I don't even know what we're going to do with those patients.
He appealed to the VRA NEDCo to temper justice with mercy and reconnect the hospital for them to resume operations whilst they continue to engage further for the settlement of the debt.
In other places, patients have options as to where to go. In our part of the country, the options are not as many as we have. If you fall and you are heavily injured, you have brain injury and you need a scan, in the whole of this region, if not in this hospital, you can't get it anywhere. So because we don't have options like elsewhere, it makes our situation more dire than anyone can imagine. So I'm just appealing to them to reconnect us so that we can continue to offer service to the teeming public.
Mind you, this is a hospital that was commissioned almost 4 years ago by President Akufo-Addo without seed capital. Several appeals made at several fora by prominent citizens of the area including members of the Upper West Reg House of Chiefs, is yet to see the light of the day. To add insult to injury, the design of the hospital is having a huge toll on its bigger finances. The design did not take into consideration the conservation of electricity at the facility.
So, as I said, we're the highest energy consumer in the design. And I'm wondering, hospital built in this country, virtually everywhere. And you also have the centralized condition that even if you need light in one operating room, virtually everywhere has to be powered. So the design is not helping us.
The cruel reality, however, is that this 218-bed hospital consumes more electricity than all major hospitals in the country, except the 37 military hospital. Reporting for JoyNews, Rafiq Salam. Wow.
Let's now get to the Upper West region and speak with Rafiq Salam, who has more for us. Rafiq, what's the situation at the hospital as we speak?
I report to you now that the situation at the Upper West Regional Hospital is not as yesterday as it was, because I just got to the hospital and I'm told that the power was restored to the facility around 6 a.m. this morning. And so the hospital has now resumed operations, and then a lot of activities are taking place at the hospital. As I speak to you now, I'm currently at the OPD of the hospital. You can see that a lot of activities are currently ongoing at this facility. And so the lights are back. The information that I've also gleaned on indicates that there was some kind of intervention from the Minister of Health from Accra, and they have been told that they should forward all bills of the hospital to the ministers for them to take action on. And so for now, the situation at the hospital is not as it was yesterday, when the patients were restless, helpless, and also confused, not knowing what will happen to them next.
So you're talking about intervention. What kind of intervention are you talking about? Has any debt been settled for the hospital?
For now, there was no debt settled, because the hospital is owing close to about 20 billion Ghana cedis. We talk about the public debt in the Upper West region regarding the NEDCo in the Upper West region. It's about 107 million Ghana cedis, and out of this amount, 82 million is owed by MDAs in the Upper West region. But in the case of the Upper West region hospital, they are owing close to about 20 million Ghana cedis. And for now, the VRA were asking that if they could pay close to about 30% for them to be reconnected. But the situation of the hospital doesn't support that. Their pay, also their bank account, shows that there's really nothing there. And so that's the reason why Accra, the ministry, has asked that they should forward all bills to them for them to deal with. But for now, nothing was paid. It was just an intervention from Accra, and then power was restored to the facility this morning.
Rafiq, away from the hospital, and since you are in the Upper West region, let me gauge your mood on the school feeding situation. We know the caterers say they will lay down their tools. What's the situation in the Upper West region?
In the Upper West region, I have visited a handful of schools, and I was told that they even didn't hear about that particular announcement. But what I can report to you that majority of them are at their schools and they're doing their usual activity. And so for them, they said, some of them probably said that the announcement came in late, and then, but for today, they are the various schools cooking for their pupils. Maybe tomorrow, they will take a different action.
Rafiq Salam is our correspondent in the Upper West region. Definitely we'll bring you more from that hospital as and when we get it. May I ask